Hi, this is Dr. Simckes, and welcome back to Fertility Partnership. It's been a minute since we've spoken. Today I wanted to talk to you about progesterone, a very misunderstood hormone. People have all kinds of ideas, but let me go over how I would like for you to understand progesterone. Progesterone is the progestational hormone, the pro-pregnancy hormone. But ironically, progesterone is also the most powerful birth control that we have. If you need proof, know this: the most important part of any birth control pill is progesterone. If for some reason you cannot take estrogen because of some other medical condition, you can take progesterone alone, and it's nicknamed the mini pill. The little thing you put under your arm, progesterone. The IUD you put inside your uterus is soaked in progesterone. All right? With me? The shot that you get every 3 months is progesterone. Progesterone is birth control, but yet it's the pro-gestation or pro-pregnancy hormone. You need to understand this. So, the way it works is a woman has an egg or follicle that grows, and it grows and grows and grows, and then in the middle of the month, it magically explodes, and out pops the egg, goes into your tube, and into the tube, and then it meets the sperm in the tube and then drifts down and attaches to the lining. Then the follicle starts making progesterone. Let's look at your lining. This would be your menstrual cycle, and you bleed, right? And then the lining gets thicker. What's driving the thickening of the lining? Estrogen. Where does that come from? From the growing egg. After the egg comes out, you start making progesterone. Here it is over here in the purple. Progesterone. What does it do? Well, it's the pro-pregnancy hormone. It tells the lining to start getting sticky. It's secretory, making secretions. Why? Because if this is day 14 at the time of ovulation, average, women ovulate on different days, 7 days later roughly, the lining has to be nice and sticky for when the embryo drops back into the cavity. Remember, the sperm and the egg meet out here, and it drifts down, and then it attaches and it sticks. So you need nice sticky mucus for it to attach. Now, if you get pregnant, the progesterone goes like this, through the roof. Why does it do that? Well, there's this hormone called HCG, and a lot of people think that HCG, which everyone knows is that little urine dipstick that you buy at the local pharmacy. Everyone thinks that that hormone was created or evolved or God made it so that one day we could go to these little pharmacies and find out if we're in trouble. But the truth is that HCG attaches to the wall of the uterus when the embryo attaches, and it starts secreting, and it tells the ovary, keep on pumping out that progesterone. So again, progesterone is made initially by the ovary, and it goes through the roof when the HCG kicks in, and eventually at around 9-10 weeks, the ovary stops making progesterone, and the placenta takes over. But what happens if you don't get pregnant? If you don't get pregnant, eventually the ovary stops making progesterone, your progesterone levels plummet, and then your lining goes, what the heck? Where's all my progesterone? And then you get a period. So how is it that progesterone is birth control? Well, because it thickens up that mucus. So when you take progesterone, it will thicken the mucus, and then sperm can't get in. So progesterone is important for birth control. So if people think they can just take progesterone because it's the pregnancy hormone, if you don't take it at the right time, it's birth control. If you take it at the correct time and to support a pregnancy, it's miraculous. It's what your body needs. Progesterone, it's a bit misunderstood. It's important, but you have to understand the timing of progesterone. If you have any questions, shoot them to me on email or Facebook or whatever. I'll be happy to help you out. Thank you. Dr. Simckes, Fertility Partnership, out.